All right. Hey guys, thank you so much for joining us for our monthly Facebook and Instagram Live. I am Chris, joining you as always. Apologies that we're starting a little bit late tonight, guys. It was actually just a slamming night here at the Shack, so we had to clear out the shoe wall before we had this to film with. We're going to be using some props and wanted to make sure that we were good to go. But we've got a very special guest tonight, guys. My friend, Monica Isola, a physical therapist from AdventHealth. Listen, as always, hit that like button, love it, wow it, share it with a friend. If you think that this is relevant to them, then make sure they know and that they watch this video. And I think this is going to be relevant to a lot of folks because we're talking about knee pain tonight. And if you've got questions about the topic while we're going, get them in after the fact too, and we'll try to answer them then. And most importantly, let us know, guys, what topics you want to hear about. That's what led us when we did our plantar fasciitis one, shin splints, a lot of our more popular videos, and here we are with knee pain, bringing it home. So Monica, beyond being a physical therapist at AdventHealth, was a cross-country and track runner at the University of Florida. I went to Florida State, but it's okay. We're still friends.
Yes,
I know.
We are still friends.
And also was a runner locally here at Bishop Moore High School, right down the road from where I was running at Edgewater. So we go that far back.
Yeah, we've been each other for a while.
Yeah, so obviously as a physical therapist, you can cover a lot about knees and understand knees and the body, Monica. What we wanted to dial into really tonight is what we see a lot of folks coming in with, and that term you hear thrown around a lot, which is runner's knee. So as not only a physical therapist, but a very accomplished runner, what can you tell us about runner's knee?
Yeah, so runner's knee, it's a very generic term. So, which it's a lot of times referred to also as anterior knee pain, also patellofemoral pain syndrome.
Okay.
So anytime something's termed a syndrome, it's a little murky, you know, there's still a lot to find out about it, but it's very, so let me grab my trusty little knee model.
Yes.
But basically, anytime you hear someone to refer about, runner's knee, patellofemoral pain syndrome, it's going to be pain that's in the front of the knee, and people can complain about pain under the kneecap. So let me first start off, let me orient you guys. So this is our knee joint.
There we go.
So here inside of this tendon is our kneecap, our patella. So it's going to move. We've got our femur up here, our tibia down here. So that is our handy knee joint. Unfortunately, though, I like to say the knee joint can be the dumbest joint in the body. And that's basically because it does whatever the joint above, so at the hip, and below at the ankle tells it to. And so again, going back to that pain, people can describe it in different areas. So I have patients who come in and their pain is kind of underneath the kneecap, above the kneecap, along the sides, even describing it as being kind of under the kneecap. But all of this is usually referred to, it's under the umbrella of patellofemoral pain syndrome. And usually it's an overuse injury, a lot of times doing things too much, too quick, and our tissue, our body, our muscles aren't really ready to handle it at that point. And people will usually describe having aching, burning kind of pain, kind of dull, and then they notice pain with running, with squatting, with going up and down stairs. There's something called a movie theater sign. So basically, people tell us, they're sitting for a long period of time. Then when they go to stand up, so say you're in the movie theater and you're sitting for 2 hours, and then you go to stand up and
car ride.
Yeah, long car ride. They'll describe that pain in the front. Yeah.
Sure.
So yeah, it's nasty, and there are different ways, and I know we're going to talk about it to address the symptoms. But ultimately, it's, again, very biomechanical because usually we need to look and address the issues that are going on above, in the joint above and the joint below.
Definitely, and let's kind of approach it that way, right?
Yeah.
So I know you're kind of saying that it can present itself in different areas, right? Some people feel it pulling in one place, some another, and it may even be, we talk about it as the chain we're fitting for shoes, right? The feet up to the hips, it's that whole chain. Mm-hmm. So different things in different people's kind of biomechanic chain might be leading to that knee pain, right?
Yeah,
but I think what we were talking about before, what we want to break it down to tonight is really specifying things that regardless of what your root cause is or what part of the knee is most presenting itself, things that we can all do to work from the bottom of the chain or the top to make the knee stronger and to stretch it out, loosen up those muscles and ligaments around it to relieve the pain, right? So even if the symptoms aren't all the exact same starting cause, we have some kind of mutual causes of relief or opportunities for relief. So maybe let's start below, because we've got everything behind us, right?
Yes,
we've got our shoe wall here. So what from the ankles, the feet, stemming up to the knee can cause that discomfort?
Yeah, so we know that if there's excessive pronation, so basically if your foot excessively tends to roll and collapse in, so people typically who have lower, flatter arches, but if we know that if we see some excessive pronation, and if you follow all the way up, as that foot rolls in, what else is moving?
And we were talking about this earlier about how when you run, it's such a one-legged motion, right? So I think when you were showing me earlier and kind of isolating, it really shows how that knee tilts in.
Yeah, exactly. If our foot is really collapsing, if we don't have good support coming from our shoe, from the ground up, we're going to get some of that collapse, which can create pain in the knee.
Absolutely, and Monica does overpronate, right? So she's wearing what we call a stability shoe. This is the men's version of it. She's wearing the Brooks Adrenaline. This has something called a guide rail. It's a denser, reinforced platform on the medial side, so the inside of this foot. So if your arches are going in, they're tracking that knee in with it. You need something more stable there. Other shoes do it differently. Saucony's got the Omni. It's a super dense, compact layer of medial foam, but it's all about stopping that collapse. And then some folks like myself, I'm very bow-legged, this is my nice technical term there, but my knees push outward. So when Monica isolates a foot, that arch is collapsing. We need to push it back to the middle. When I isolate one foot, everything wants to push towards the outside. So I need a shoe on this lateral, this outside edge that's reinforced to make sure my knee doesn't push towards the outside. Because like she was saying, like, we can get those pulls in any direction that lead to the pain on the patella. So that's a fancy word for kneecap. So you want to make sure that foot is stable in either direction. And that's what we do with our fit process. And then talking about overuse. You can have overuse of the body from running, but we can overuse our shoes.
Absolutely.
And that can kind of tie into the pain getting worse sometimes as well, right?
Well, and I learned from your mom too.
There we go.
I tell all my patients who are mostly college students, but I tell them your shoe should never see a birthday.
Absolutely.
And when I tell my college students, they kind of like what? Like their shoes are probably like from back in high school. But it's true, because they break down and that stability
it's foam
isn't
at the end
there.
of the day. Every 400 miles or so of use, it starts to go. And if all of a sudden that component that's supposed to stop Monica from going in or me from going out isn't there, that knee comes right out with it, right?
Yeah, absolutely.
So that's how we're stemming from down below, right? And because like you said, the knee's not making its own decision. It's everything to the chain. So it's either down there or it's up here. So talk about how the upper part of your chain can affect this knee pain, and then maybe we'll work our way into some stretches that we can do, and then I think we'll tie it home at the very end with strengthening for that upper chain to try and be as preventative as possible here.
Yeah, absolutely. So so looking up above, if we have weakness in the hip muscle, so going back into the fact that running is a single leg sport. Every time you run, you jump, you basically land on that one leg, you're doing a mini squat. If you have weakness up in the hips, this is also going to contribute to that crashing inward of the knee. So again, leading to just increased pain along the inside. It can put more stress on the joint, the tendon down here, our patellar tendon, create issues with our kneecap, our patella, all that kind of stuff. So definitely stabilizing the hips, so stabilizing the pelvis, the hip joint, and working on strengthening of a lot of the muscles up in our hips. And, again, we tend to just, when we strengthen, we think of the muscles in the front and the back. We think of our quads, which is important, but we tend to just think of the front and just think of the back. We forget the side motions. We need to work laterals, and we'll go a little bit more into that. But
let's go ahead and do that right now. You know what? Let's talk strengthening. Originally, I was going to do stretching and work to strengthen it, but we're already there.
It's
so
all good. Yes,
let's talk strengthening. And this, guys, is really important. Okay, so when we're talking about strengthening, we're talking about how to get the knee pain gone, hopefully permanently, and it's a long process. That's a lot of what physical therapy is, right? Is learning those exercises, learning how to stabilize. So we're getting rid of some of the symptoms, but also the root of the issue. And then for you folks watching, say you tune in every month, you've never had runner's knee, you don't have knee pain, you want to know how this is relevant to you? Well, these are exercises that you can do to make sure, or at least hope to prevent as much as possible, the chance of getting this type of knee pain. And so after Monica runs us through some strengthening exercises, that's when we'll get to the stretches. And that's for you folks that are having knee pain currently. Stay tuned, because we're going to tell you how to get some relief for the symptoms. But right now, we're working on that long-term strength. And again, if you're just tuning in, I'm Chris. I'm here with Monica Isola from AdventHealth. If you've got more questions about this too, go to adventhealth.com, book an appointment with a PT like Monica, who will show you exercises like she's about to show you right now.
Yeah, I mean, this is my jam. This is what I love as a PT.
Let's do it.
So
you let me know if you need any of these toys, okay?
Yeah. So to start off with, again, the two big things runners really need to think about when they're going into the strengthening is single leg. Work that leg on its own. So if, say, you're in the gym, and this is what I do, the leg extension machines, the leg press, I do one leg at a time to really strengthen each individually, because one leg is naturally can be stronger than the other, so that leg will do most of the work if you're doing everything double leg.
Right.
So off the bat,
you'll fall back on it without realizing it.
Yeah. So right off the bat, if you're going to the gym, do that. Isolate one leg at a time. And then the second thing to think about, so you want to first think about single leg exercises. The second thing is work those lateral muscles. So
resistance band?
So let's get that resistance band out.
Available at Track Shack. Protect resistance band.
But seriously, these are the best, and there's so many things, so many different exercises you can do with them.
We got a couple of different strengths here,
colors.
We're gonna go with the blue matches our shirts.
Yeah. Oh, there we go. And typically, the darker the color, the more resistance. But either way, okay. So you're gonna get one of these bands, and you're going to put it around.
Yeah, don't do it to match your shirt. Start lighter, but Monica can handle the high resistance, guys.
There we go. So you want to put it right above your ankles. From here, you want to be taking some steps to the side. You want to stay kind of in that little mini squat position. Again, really making sure too, and I'm going to turn to the side. When you're doing a squat, you want to make sure your knees are never past your toes. So imagine there's a line from the front of your toes all the way up towards the ceiling. Your knees should not cross that. If they do, that will put a lot of stress on the front of that knee. So sit your butt back. So let me turn now. And then you're going to just take steps to the side. There we go. Yeah. You kind of want to lead almost with your heel a little bit.
Okay.
So you really, because the tendency is wanting to turn your toes out. There we go.
Yeah.
I know.
Okay.
So then you're just going to take steps. Go. The whole point is go to where you feel burned. So doing a couple laps back and forth, but making sure there's always tension in the band. There we go.
Absolutely.
Yeah.
Okay. I have really weak hips, so I'm feeling stronger already, guys.
There we go. So that's an excellent one. And then I'll just throw this over. Then two other nice ones that are again single leg is going to be a single leg clock squat. So you can tap. So again, you're going to squat with that one leg, and same rules apply. You never want that knee too far forward. You don't want your knee to crush in. You want it to stay in line with your foot. So you're going to go forward, out to the side. You can go back. Honestly, it doesn't matter. You can go through, do whatever you want. Basically, you're focusing on that squatting leg. So if you want, you can tap the ground. If you want to be fancy and you want to really push yourself, you can keep your foot off the ground. But again, it's all about stabilization, which is, again, that hip is working hard, that foot's working hard. So you really want to work on stabilizing that knee.
And these are our long-term, remember, guys. These are the fixes to be practicing if you're not having knee pain, to prevent it, and also to be working on if you have some, and delicately, right? That's where physical therapists can come in handy to realize how much you can handle, but to work your way back to being healthy.
Absolutely.
And did you have one more?
Yeah. So one other awesome one.
Stretching. Yeah.
Yeah, and so I'll demonstrate this one. So it's just a single leg deadlift, or we call it RDLs, but a single leg deadlift, where you're gonna, and I do it at the gym with maybe like a 5 or 10 pound weight. Doesn't have to be anything fancy. But this one, you're not actually bending your knee. You just keep it soft, and then you're reaching. I know you're reaching with your opposite arm. You're going to reach forward while keeping your back flat.
And shoulders kind of rolled back, right, to help keep the back flat. Is that
and then you're going to bring it back.
I know how I should be doing an RDL, but then my body rejects it.
There we go. So, but again, we all have our starting points. So just remembering the concept of you want to keep your back nice and flat. And you know, if even this is as far as you go, that's totally fine. I mean, just standing on one leg right there is stabilizing the hip muscle. Works on the hip muscles, helps to stabilize the knee.
And we can't stress the flat back enough, because you don't want to bend over and suddenly have some undue hip issues because you're not keeping the back stable.
Yeah, exactly. You want to hinge through your hips as you're going forward and not, you know, rounding through your back.
Exactly.
So I always teach people, I have people put a pole behind their back and it can't leave their back. As they go all the way down, that pole cannot come off. So that's another kind of good way to train into it.
So
but yeah,
I think that's strengthening, right? Are we pretty?
Yeah. I'll throw in side planks there. Side planks are always great. Front planks, because it works the whole core. And when we talk about core, we tend to think of just our abs. It's really mid-chest to mid-thigh, front and back. So that whole area has got to be solid.
I think that's common, right? That people who work the abs with the glamour muscles and kind of forget about the back, and then that back gets weak, right? You have a nice six-pack, like obviously I do, but then your back is just sore because you're not balancing it. But look, strengthening has been great. I think it's really important, because again, strengthening is about the long-term prevention, guys. But if you're already feeling this pain, you know the physical therapy might be a journey. You know you might have to work on strengthening for a while, but you're still hurting every day, even if you're not running. So I want to get to the stretches we can do to get some symptom relief to feel better. But before we touch on that, Monica, we did get a question from somebody on Facebook, and they want to know if you have thoughts on running after a knee replacement.
Oof. Oh, that's a tough one.
That's how I felt.
Yeah. So, man, it's every patient, every person who gets a knee replacement.
Only if it was done at AdventHealth, right?
I know. Well, they're just all different, right? So it just depends. First off, where were you at before your knee replacement?
Sure.
There's a lot of factors that go into, you know, how long, what was your knee motion before the surgery? What is your knee motion looking like now? I know, of course, you know, you want to talk to your physician, talk to your surgeon, see what they think. And, you know, again, they're probably not going to give you really a straight up answer. Because, you know, the replacements that they're using now, we haven't been able to really see them and how long they last. It's definitely it's going to put stress on it. So it's, you know, shortening that timeline and that integrity of the knee replacement. So, I mean, I, again, hate never saying never. I'm all for trying to reach, especially, it's all about quality of life if this is your one goal in life. But again, you have to weigh risk versus reward. So,
and I think, like, I have a friend I trained with who has a hip replacement and was basically told, you can still run, but you'll eventually need another one. And she's like, I'm hardcore. I'm just going to take the other one when it comes to it. I think that's probably part of it, right? And then not to oversimplify, but anyone who's getting a replacement is probably going to physical therapy, right? So leaning on your physical therapist, like an AdventHealth physical therapist, say Monica Isola, and you can book those appointments at AdventHealth.com. But, you know, as you're going through that process, maybe that can create a clearer answer, right? As opposed to, like, right when you're coming out of that OR. And I just don't want to get, you know, too far in on that subject, because I do still want to hit these stretches for our folks at home with runner's knee. So if you have more follow-up on the replacement, hit us with that in later days.
And just make sure to get that full motion first before running.
Before trying it all. Yes, definitely. And that's where that physical therapy comes in handy, right? So if we have runner's knee, we know we need to be strengthening, but in the meantime, we just want to feel better. We want relief. So again, we're talking symptom relief. Not that it'll make it all go away, but make you feel better throughout the day. What are a couple good stretches we can do for that, Monica?
So you definitely want to be hitting the quad muscles, so that those muscles, tightness of that quad can be a big culprit of knee pain, of anterior knee pain or patellofemoral pain syndrome. Your hips, it's a group of 4 muscles. They start up at the top of the hip, and then it goes all the way down, and your kneecap is actually inside of that quad tendon. It connects down to the bottom. So if your quad is crazy tight, that is going to push and add a lot of pressure onto the front of the knee. So definitely, you know, I would really attack, before anything else, you know, attack the quads, and we'll show that in a second. And then also you really want to make sure you're hitting the calf muscles. So, and I'll show you a little trick, because we tend to think of our gastroc, which is like that big calf muscle. Oh, there we go. But it's also really important to make sure you hit a deeper muscle underneath called your soleus. Because that's actually, you know, that's actually what's being worked more as we're running, because our knees are always slightly bent. We want to stretch all of those out.
I think just for the sake of time, because we hit on earlier about dynamic stretching and static.
Yeah.
So let's tie it home with calf, because this is my favorite toy, and I saw your eyes light up too. I think if you want to work the soleus, this guy. So all right, Angel's already on me. I'll just take over. Monica will tell me if I'm doing anything wrong. But this little $13 hunk of styrofoam we've got here, but you put the ball of the foot on it, drop the heel into the ground. That by itself is a decent stretch, but if I take my opposite leg and step parallel, now I'm even deeper. And then if I really want to open up that soleus, I go further in front of my little stretcher here, and just the further you go, the more it opens up, and you can also sink back into that heel there to really open it.
And then, so to go a little bit more into that, so as you're stretching that, so you're going to target, you'll target the gastroc really well. To get the soleus even deeper, you're going to slightly bend your back knee.
Okay.
So, and then you can stay going forward. You're going to feel it slightly lower, so you're actually going to feel it. So go ahead and try it.
Yeah, I'm really ridiculous. So.
Yeah. So you're leaning forward like a normal one, but then you're going to slightly bend that knee.
Yeah.
And then you're going to feel it down here.
All the way down.
That's hitting the soleus.
Achilles, no doubt.
And I'm telling you, I've had some patients where that was the issue, and that's what was causing a lot of their knee pain.
Awesome. So that's calves.
Everyone's, So exactly. So those are calves, and these are, again, more holding. So with that, you want to hold it 30 seconds 3 times. So we are as runners, and I know how we are, where we like to just kind of like get into a stretch really intense and hold it a couple seconds. All right, next side.
Sure.
Hold it a couple seconds. Yeah.
And because it's static, good to do after you run, I think is good to point out.
Yeah.
And so that makes sure, then we said, so you're warmed up, right? So you have more blood flow. And that's why we just talked about both dynamic and static stretching. Dynamic's good before you run, because we're going to move while we do it. And then static better for after. So the quads being that next important muscle group. I think when we were doing this before, it was kind of the same stretch for dynamic and static, Monica. But one being where you hold it and one where you're kind of on the move. If you want to just quickly walk us through that.
Yeah, so again, dynamic stretching, you're moving through the motion. It's just really to increase blood flow, getting you ready for your exercise. So you're going to grab your foot. You want to bring it. And so first off, it's not as important to bring it all the way to your butt. It's more important to have better alignment and bring your knee back slightly. So you're just going to do, kind of bring heel towards your butt, and you're going to hold for just a couple seconds and switch.
And you're going to walk while you do it, right? And that's how you're keeping that blood flowing. Okay, cool.
Yeah. So then same thing for your static, your hold. So again, dynamic before you run, static afterwards. You're going to hold it. So there's lots of different ways to do it. This is one way that if you're out in the park. There we go. Yeah, if you're out in the park or whatever, and maybe you don't want to get on the ground, this is an easy one.
Run at the park.
Again, it's not as important to worry about getting that heel to your butt, because some people can do that, but then their knee's out here. That's not doing anything. You really want your knee. So if you look from the side, your knee should be in line with your opposite knee, and you can even bring it back just slightly. Keep your chest up too.
So posture and the alignment of the two knees.
And
now that I try to work on the posture, Monica, now we're having trouble. Now that lack of stabilization is coming into play.
Yeah, hey, you're working on stabilizing while you're stretching too. That's it. There we go.
That's a win-win.
Yeah.
But so guys, look, that's what you're doing if you're feeling this pain, right? We want to do those stretches for some symptom relief. We want to work on the strengthening Monica did earlier if you're not having knee pain and want to prevent it, or if beyond that temporary relief, you are wanting to go for that long-term solution, which of course we all do. So strengthening to help get better or prevent, and stretching to relieve those everyday symptoms. I've got a question about compression with plantar fasciitis. What I actually want to suggest that you do is hop back. We did plantar fasciitis. It was a whole topic. So jump on our Facebook Live feed. They're all canned because I know we're going a little bit long today, and I have a few housekeeping announcements. Monica's been great, but check out Shane and I talking about plantar fasciitis, and we will cover that topic. But the same way stretching is symptom relief for the knees, compression sort of is for plantar fasciitis. That's the quick answer I'll give. It can give you some relief through the day, doesn't address the root issue. This guy can help with that as well, and we do explore that in that video. So definitely check it out. But Monica, I'm going to jump into just a couple Track Check specific announcements here. Thank you, first of all. You've been awesome again. I'm Chris Hughes, here with Monica Isola, my friend, physical therapist at AdventHealth. Awesome runner. It's so cool that we have the opportunity to work with great partners like Advent, and then when it ends up being someone I ran with in high school, it's a win-win. But do you have any kind of if you could tie this up in a nutshell, final notes on runner's knee and just knee stress in general?
Yeah, so final thing, you're feeling, you've been running, you're feeling some knee pain. first think what's going on above, what's going on below. How old are my shoes? Do I need to get new shoes? When was the last time I worked on some strengthening of the hip? You want to think both ways. Get those shoes, do some hip strengthening. Stretching is always super important, but just make sure when it comes to the knee, really think above and below, and that is going to address, really a majority of the issues.
We're working that whole chain, and if you want to set an appointment with Monica or one of her peers, AdventHealth.com. They have a great physical therapy group. And guys, that's it on knees. I just want to tie it home with a couple of things. Next month, we are talking half marathon training. We are going to have training expert Susan Paul here to talk about our 13 weeks to 13.1 miles. She is the head of our training programs, also a Runner's World coach, as good of a guest as it gets. What's that exact date again? I should know it, but stay tuned. September 9th is when Susan and I will be sitting down for that. Sorry, guys. We had to stumble through that one, but that's the beauty of being live, right? So that's the 13 weeks to 13.1 miles. Check out TrackShack.com always for all of our meetups, our free runs, our clinics. We do good form running, foam rolling. There's more than just this live. And I know it's been a long time, but you guys know me. I'd be remiss because these just came out. Aeropex from Aftershocks, my all-time favorite headphones, our collective staff favorite here. These are lighter weight, best sound they've ever had. We weren't supposed to get them until September. They came in hot today. Check them out. And my new favorite personal product, I already have 3 of these. I kind of have a problem, but my hair is longer. I sweat a lot right now. This is the one hat that keeps it out of my eyes in the summer. They're also super stylish. This is CLA Athletics. They're out of Montreal. My good friend Alex Luna is actually the sales rep. You might have known him if you're a longtime Track Shack person because he worked with us with Saucony before. But got a bunch of really fun colorways, and if you've got a kid running cross country, super limited run of their XC edition right here. And guys, that is it for us today. Thank you so much again to Monica. Thank you guys for bearing with us, starting late and going a little bit long. But knees are a complicated subject, so we needed the time. I hope that really helped.